Hello, today let's talk about what is the difference between degenerative disc disease and degenerative joint disease. Now, these terms might have been used by your doctor, or you might have seen them on your X-ray or MRI report, and you might have wondered what these actually mean. And if you've seen somebody else's reports, or you've been first diagnosed with, say, degenerative disc disease, and then the doctor's given you a diagnosis of degenerative joint disease, you might be wondering what is the difference between these two. So let me address what these terms mean and what is the difference between these two. So once you have a better clarity of what's happening in your spine, you would be able to manage it better. You'll be able to talk to your doctor better and understand your treatment better, right? So let's look into these terms today. So before we get into the topic, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and joint pain. And I do this by giving you simple exercises, easy lifestyle changes, some tips, tricks, and hacks. And I do all this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? And I also talk about some non-toxic natural alternatives that have worked for me in my own spinal and joint pain journey. So without taking up more of your time, let's look into these terms, that is degenerative disc disease and degenerative joint disease. Now, they're also known as DDD or DJD. DJD is the degenerative joint disease. It's also known as arthritis. Some people might even call it osteoarthritis. However, when you're looking at arthritis in the spine, there are quite a few varieties, but the common one is osteoarthritis. So, doctors or people around you or healthcare professionals might refer to DJD as arthritis or osteoarthritis as well. All right, so let's look into the two conditions now. Now, before we get into that, just a little bit about the anatomy of the spine, which I'm sure you'd be aware of, but just a refresher, a very basic refresher for you. Your spine is made up of vertebrae that are stacked on top of each other. Now, between every two vertebrae, all the way from your neck, that is a hairline here, right down to your tailbone, you have something called a disc, which is a spongy gelatinous structure that is present between the two vertebrae. Every two vertebrae, there's a disc, also known as an intervertebral disc. Now, why do you need this disc? When you, if you put two porcelain items together, or two, say, porcelain plates or dinner plates together, if you're packing them, you would put a paper or a bubble wrap or something in between to cushion them so that they don't rub on each other, they don't break by putting pressure on each other. Similarly, between your two bony vertebrae, this is a beautiful design of the human body, right? So there is a gelatinous structure which is known as the disc, and it acts as a shock absorber. And of course, it prevents those two bones from rubbing on each other, right? And also that space that is created between the two vertebrae by that disc in between, on the sides, either sides of the spine, there are nerves that are exiting the spine at the level of the disc. So the disc is very important. If the disc is not there, obviously there's going to be rubbing between the two vertebrae. There might be pinching of the nerves, etc. Now, what happens in degenerative disc disease is that sorry, just looking at my notes here. Yeah, so the disc will lose its ability to absorb the shock. That is the shock absorption. Function. Sorry, there's somebody outside my window. So the shock absorption function is reduced, and thereby sometimes when the disc is, say, the has a lot of water content, so when it starts to shrink and lose its water content, there might be a potential rubbing of the bone on bone, that is vertebra over the vertebra. And if there are bony spurs that develop, then that can even pinch the nerves and you might have nerve pain. Now, all this will lead to pain, stiffness, and of course, if you have nerve pain, then you have tingling, numbness, you might have weakness in your arms and legs. So all those symptoms come in. Now, when you look at the spine, there are some other structures in the spine as well. Of course, there are like the bony elements, not just the disc, but the bony elements, as we mentioned. There are ligaments, there are muscles, etc. Now, In degenerative joint disease, what happens is the bony part is affected. Now, it is not just the two vertebrae that are stacked on top of each other, but the vertebrae also have joints on either sides. Now, there is something called a cartilage in our body. Usually, it is present whenever two bones are meeting. The cartilage is the protective surface on the top of the bones so that when the bones are, say, sitting together, they don't rub on each other. So there is like a spongy cartilage there. When this cartilage wears out, that will lead to arthritis type of symptoms, and this obviously happens in osteoarthritis, but this is the general term that degenerative joint disease refers to. Now, of course, when it breaks down over time, then you have pain, stiffness, loss of mobility, etc. Of course, you can have nerve pains, and but it's symptoms. The symptoms between the two conditions are quite similar. It's just that, remember, degenerative disc disease is more to do with the disc, and degenerative joint disease is more to do with problems with the joints within the spine. Now, these two conditions can coexist, or they might exist in isolation to start off with, and then they can trigger each other off, because the spine will not work in isolation. They will always, our body doesn't work in isolation, always works in conjunction with the other parts, right? So, the basic problem with both the diseases, now this was the difference. The commonalities are the symptoms, plus the basic problem is inflammation. When there's inflammation in your disc, obviously with the disc is there's a problem with the disc, there's inflammation there. There's a problem with the joints, there's cartilage is rubbing out, those bones are rubbing on each other, obviously there's inflammation there, and inflammation is what leads to your pain, loss of function, the redness, the swelling, etc. These are like the signs of inflammation that you see, and that leads to all the symptoms of pain, loss of mobility, and stiffness and nerve pains, etc. Anyway, so that's just going around in circles, but basic problem is your inflammation is actually the root cause of most of the diseases in our body, even if it's like something as remote from the spine as Alzheimer's, Parkinson's, arthritis, of course, and your gut problems, etc. Everything is the basic problem is inflammation. So, okay, so that was what I wanted to highlight about DDD and DJD, that is degenerative disc disease and degenerative joint disease or arthritis in the spine. Now, if you're looking for more details on degeneration or arthritis, you can have a look at my YouTube channel. I've done a couple of videos on there recently. You can go to YouTube, type my name, Swati Prakash, arthritis or nerve pain, whatever topic you're looking for, and it'll come up with that. Also, I have written a blog on the same topic about what is the difference between these two conditions, and I will leave a link in the description of this video about that blog. And I will, if you're watching me on Instagram, the link to the blog is in my profile in my bio. Once you click on it, it'll come up with the blog. But in that blog, I have mentioned a 11-day free program that I have done recently. Well, I've been doing it since January this year, so it's going to be a year now. So I do that every year. Every month I do that. It's an 11-day free program, and that has helped me to manage my inflammation and get my back and neck pain down to zero. Yes, I know it's difficult to comprehend that, but it has actually happened. And with my knee pain, because I've got really bad degeneration in my knees, the knee pain has gone down by about 70 to, I would say, 75%. So, and I'm back to my exercises, which I never thought I will be. So I have had very good results. There are other people with arthritis, spinal problems that have had good results. So I will leave a link to that in the blog, the 11-day program. And once you click on that link, you will come up, there are many testimonials on there. And of course, I can clarify it further for you. Alrighty, I hope this was useful. If you're looking for that solution, feel free to message me, feel free to click on that link, whatever works for you. And if there are any questions, any comments on